All right, we're just going to touch on the topic of exercise prescription. You'll get this later in the NSCA textbook if you take remaining courses in the exercise science curriculum. But we'll just briefly go over it today. So exercise prescription is just like when your doctor prescribes a pill. They tell you how much to take, what to take, how often to take, and how long to take it. That's the same thing we do with exercise prescription. And the goal of exercise prescription is usually to increase a person's fitness level. But we also have national guidelines to promote physical activity. And these guidelines are not necessarily to increase physical fitness, but to decrease risk associated with inactivity and to promote healthy outcomes. So decrease the risk of heart disease and some stroke and cancer. So these are just general recommendations that are made by the government, and they are based on research that show when people exercise 150 minutes of being physically active at a moderate intensity on a weekly basis, they do decrease the risk of many negative health outcomes. Or they can do 75 minutes at a vigorous intensity. So the one adult might do 150 minutes 5 times a week, do 30 minutes of an easy walk, and then somebody else might do 75 minutes of a run. And so those are where they will, it's believed that they'll have some positive health outcomes. And then what research also shows us is it's dose dependent, meaning the more we do, the more positive consequences we're going to have. And so if someone doubles their moderate intensity to doing 300 minutes a week, and that more vigorous exercise or doubles it to 150 minutes of vigorous intensity, then they're going to even get more health outcomes, positive health outcomes. And children are 60 minutes daily. They should do at least 3 days a week, should be vigorous intensity. And both adults and children and adults throughout their lifespan should do some type of resistance and flexibility training. So the resistance training can be bands, it can be dumbbells, it can be using your body weight, and all of those are used to help to promote stronger bones, as well as decreased muscle loss that occurs with aging. And flexibility is also important for us to maintain range of motion around our joints so we can maintain daily activities that are required in our everyday life, but also for athletic performance, especially sports that require a greater range of motion for performance. But when we talk about physical fitness, we're talking about the intent to increase someone's fitness level. And that could be we're trying to increase their fitness level so that they can do chores around the house or daily activities or for their work or for sports performance. And so there's 5 components that we need to consider when we look at physical fitness. And the first is cardiorespiratory fitness, and that's your aerobic exercise, and that's so that we get those positive benefits at the central level, at the cardiac level, like the increased stroke volume, as well as peripherally the increased oxidative capacity in the muscle. And so that's, more steady state aerobic types of activities. But we also want to incorporate muscular strength. The muscular strength is the maximum force that you can exert with one repetition or a single contraction of the muscle. So we do usually more heavy weights to increase our muscle strength. And muscular endurance is usually lighter resistance, high reps, and that's to promote the ability of the muscle to contract and relax repeatedly without fatiguing. And flexibility there again is important for us to maintain our range of motion as we age, as we do certain types of activities that are repetitive. We have a tendency to tighten up some muscles, or we might have lax muscles in other groups. So we want to have a balance of flexibility where we can move completely through a range of motion. And then body composition, and that's where we have a healthy amount of fat on our body that does not increase our risk of disease. So all 5 of these components should be in an exercise program, and I'm sure you can look at yourself or some individuals who are terrific at running every day, but they totally neglect any type of strength or muscular endurance component. And then just the opposite, you might have some people who lift weights and neglect the cardiorespiratory fitness. Some people, admittedly, neglect doing any type of flexibility training. So all of these should be in any program. And before a person starts exercising, we do we want to make sure that it's safe for them to participate in an exercise program. And years ago, we used to say to people, if you're over 40 years old, you should have a stress test. And what that resulted in is that people did not get the stress test because of the cost and the weight. So what they would do is just not exercise. So there's been kind of a decrease in that higher level assessment that is required. And there's an attempt to only identify those who maybe need that higher level of assessment. And the PAR-Q is just a simple tool that can be used, and it's an attempt to identify people who should be seen by a doctor or get clearance from a doctor before they participate. The health appraisal is a step up. That's where personal trainers, exercise specialists work with an individual and they find out any history for knee problems, back problems, cardiac problems, asthma, and they find out about their exercise habits, and it just allows them to maybe more finely tune an exercise program. And then the graded exercise test is one of the higher levels of assessment pre-exercise, and that's where graded means that we increase the speed and the grade in steps. And so with these smaller steps, we can see where a person might have changes that indicate that exercise is too much. That's usually for someone maybe who has a medical history, a history of cardiac problems or something like that. But the PAR-Q, if you can see here, just asks some real basic questions. Have you ever had a heart condition, chest pain? Do you have dizziness, any joint problems, bone problems? Is your doctor prescribing any drugs currently for blood pressure or a heart condition? And is there any other reason why you should not do physical activity? So it's an attempt. If anybody answers yes to any of these questions, then they're directed to see their physician. So what it allows us to do, this easy tool, is get people started right away who there's no reason why they shouldn't be exercising, and then those who maybe need to be further evaluated to get them to the doctor first. Now, there's no 100% tool that we can say identify people who are or aren't going to have problems. There are people who have had stress tests and pass the stress test fine, and then they have a cardiac event. So nothing's 100%, but these allow us to try and discriminate groups that need the further evaluation. So some of the basic principles when we are training to increase fitness levels, the overload principle, which we've already looked at, is we have to, as a person adjusts to a work intensity, for them to make further improvement, we have to increase the load. So we have to have them run faster, run farther, um, um, run more frequently, or lift a heavier weight, increase the reps, decrease the rest time, increase the number of sets. Those are all ways that we can apply the overload principle. Specificity of training we've had before as well, and that's just the idea that the muscle groups or the energy systems that we train with are the ones that get the benefit. So if I'm going to run a marathon, I'm not going to be swimming to train my muscles, because I would be training my arms instead of my legs. So if I'm going to do a marathon, I should do some type of running training. And a marathon is not sprint work. It's not using my glycolytic system. It's training more my oxidative system. And so we want to train more specifically to runs that will use that oxidative system. Individuality is the idea that we're all individuals. We all start at different levels of fitness. We all progress differently. We have different muscle fiber composition. We have different medical histories. So the exercise program should be tailored to each individual, and we shouldn't start everyone out with the same type of program. And then the idea of progression is that we want to progress our workloads at an appropriate pace that allows us to prompt training but not overtrain an individual. And then variety is with the idea with specificity of training that only the muscles we work get the benefit. If we have a variety of types of activities, we're going to train many muscle groups. We're also going to decrease the risk of injury. And we're also going to decrease dropout rate because people who have a lot of variety in their program tend to be more motivated. So if you combine a swimming program, biking, walking, and you do them on different days, then you're going to have a much greater training effect and compliance. And reversibility is just the idea of detraining, is once we stop exercising, we start to lose those benefits that we've achieved. And each exercise session should consist of a warm-up, conditioning period, and cool-down. The warm-up is important to prepare our body for the upcoming exercise. We're going to gradually increase our heart rate, so we're going to allow ourselves to increase the demand on our heart muscle as it pumps faster, slowly. We're going to be able to dilate and send more oxygenated blood to our working muscles so that we can do oxidative energy production, and our blood pressure is going to increase slowly. So this just prepares the body for the upcoming exercise. And then the cool down is important because this allows us to recover our heart rate and blood pressure in a normal fashion. So what happens if someone doesn't do an adequate cool down? We've sent a lot of blood to our working muscles, and now if we just stop abruptly after exercising, gravity will hold that blood down in the legs, and so it will decrease the venous return, the blood returning to the heart. And we know that when we decrease venous return, there's not as much blood to be pumped, so the stroke volume is going to decrease. And if we don't have as much blood being pumped out, it might cause a hypotension or a low blood pressure, as well as dizziness because not as much blood is being pumped to the head. And so how the body tries to compensate for this decreased cardiac output is the heart rate increases. And so this is not normal recovery for us to have a racing heart rate after exercise. So cool down is really important. Another important component to it is it decreases the chance of having electrical abnormal reactions in our heart that could put us into an abnormal heart rhythm. And so this is what, if we were to graph heart rates when someone exercises, you can see they do a gradual warm-up. They maintain their exercise intensity for their main bout of exercise, 20 to 60 minutes, and then they taper their intensity and cool down.